Answers with Dr. Malu. And in the past 1 week, we've received so many questions from so many people asking very similar questions to what other people have been asking. So we decided that we would repeat the same session that we had last week. For those of you that could not join, you can join us right now. And for those requesting to join, we would accept you once you accept to request to join us. You can also ask your questions while we are on, and we will be able to attend to those questions right away. In the meantime, we'll go to the questions that we have right now and try to do justice to them. So, I'm here with Dr. Ada, and Yvonne is the camera lady, and AC is her backup agent. So thank you once again for patronizing us. We make it a duty to serve you every day, and we also want you to know that we want to improve on our services on a daily basis. So if you have anything, you have suggestions on how we can make service to you better, you can always let us know. In the meantime, we'll go to the questions right away. So what's the first question?
Okay. So many of the patients ask, what exactly is liposuction? Yeah,
we are in Nigeria and the procedure is new to Nigeria, so we'll keep asking answering this question again and again. What is liposuction? Liposuction is a combination of two words, lipo and suction. Lipo signifies fat, and maybe reduce the movement of your paper, your paper movement, so that you have this thing. So lipo signifies fat, and suction signifies taking out. So liposuction is simply removal of fat from particular areas of the body. We call it liposculpting because we don't just remove the fat haphazardly. We remove the fat in specific areas to give out a particular outcome. So if I'm doing a liposuction of your tummy, the aim is to remove fat from the tummy and try to achieve as flat a tummy as possible. If I'm removing from the sides or the back, it's the kind of sculpting that we're doing. But all we do is we work within the fat area. We don't go beyond fat. The body is separated into different compartments. You have the skin, you have the space between the skin and the muscles. It's called the subcutaneous space. And the subcutaneous space is actually occupied by fat. After the subcutaneous space, you have the muscles, then you have other coverings of the body before you reach the bone, or even before you reach the intestines when it comes to the abdomen. So we walk very far away from the intestines. We are not close at all. We walk in the space just beneath the skin to do a liposuction. So this is what we call liposuction.
So is there a difference between liposuction and a tummy tuck, or are they essentially the same thing?
No, they are not the same. Liposuction is different from tummy tuck. Tummy tuck is the tightening of the tummy wall as well as removal of excess skin or trimming of excess skin. So people who need tummy tuck are those who have had weakness in the abdominal wall. And the common group of people are those who have had several pregnancies. That weakens the abdominal wall. It's very rare to see a person who has not had kids having weakness in the abdominal wall. Most people who have not had kids, all they need is a liposuction. So, but after huge, this growth in the womb, what do you call it?
Is it hernia?
No, not hernias. Fibroids. Yes, people have had very big fibroids. They could also have some weakness. But it rarely gets to that point of requiring a tummy tuck. But several pregnancies will usually result in weakness in that abdominal wall, particularly the muscles that tighten the abdominal wall. They are called the rectus, the recti. So that's plural of rectus. So when you have this, it's called rectal diastasis. It's opening out of that space. And in that case, that wall needs to be tightened. And in the tightening of the wall, after the tightening of the wall, you now trim the excess skin, giving rise to a tucking of the skin. That is what is tummy tuck. So tummy tuck, from my explanation, you see that it's mostly for people who have had several children, while liposuction is for anybody. Anybody can have liposuction. They will recommend tummy tuck for those who have had weakness in the abdominal wall.
So do you want to say anything concerning the price or?
Yes. Okay. Maybe we'll talk. Yes, that's maybe the next common question. What's the cost? What's the cost of liposuction? Now, there's no particular specification of the cost of liposuction or tummy tuck because it involves a lot of things. When you come, first you have to see the doctor. There's a consultation fee and a registration fee. Thereafter, it depends on the areas of your body that you are interested in taking out the fat from or working on. If you want to do your tummy and your back, because some people have said, I just want to do my tummy, I don't want to do my back. The tummy and the back always go together, because if you just do the tummy and you don't do the back, it's like a half-baked cake. It's not complete. It has to be a 360 kind of thing. So the cost of that is also different. Then some people also want to do the arms. It's an additional cost. Some people want to do the thighs. Now in the thighs, is it the inner thighs you want to do or the whole circumference of the thigh? Then some want to do the knees, some people want to do the legs, and some people want to do the feet. So the cost of liposuction depends on the areas of the body that you are working on, and not just, there's no fixed price for liposuction. And then you also have to do the lab tests, the blood work, and for all our patients, we always have a backup of blood. We may not need to transfuse, but we always make arrangements to have blood, because liposuction involves removing fat, and fat does not stand alone, it's mixed with blood. So as that comes out, you expect that there may be some bleeding. So in case you lose a lot of blood, we actually prepare blood to transfuse you. So all these things are built into the cost of liposuction. You also need to stay on admission for at least 1 or 2 nights. That is built and also. Then after the liposuction, we recommend that people should have massages. So the cost of massage is also built into your cost of liposuction. These are the things that make up the cost. So you can see that there's no particular cost for liposuction. You can see that there's a range. There's none of these procedures that is less than ₦1 million, because it's very expensive to take people to theater to do the things that you are doing. It's an aesthetic procedure. It's not reconstructive, even though it can serve for reconstructive purposes, but it's aesthetic primarily, and we want people to prepare for it. It's not an emergency. So if you don't have the money now, you can save towards having your procedure. Any day you have your procedure is the good day. There's no bad day to have a procedure. So don't be in a hurry that I must have it today. No, plan for your procedure. You can take your time and have your surgery, but it's not a cheap procedure because a lot of things are involved in the procedure.
Frequently asked also are complications.
Okay.
So you can call them side effects, but I know in surgery we call them complications. So what are the possible complications we should actually anticipate?
Yes, side effects, we talk of drugs. When you're talking of side effects medically, we talk of drugs. And just like drugs, every drug has a side effect. Paracetamol, if you take paracetamol, you may become nauseous. We consider that a side effect. So liposuction also has some side effects include. The side effects, we don't see it in that light, they are complications because they are outcomes of the procedure. Now, what are the common complications we have? Pain is number one, because if you have a cut, pain naturally follows. So we expect some pain. That's why even while you are in the theater, we give you some pain medications, even while you are asleep. Then after you've woken up, we also give you pain medications intravenously, intramuscularly, or orally. All these are to help in taking care of the pain. So pain is actually our commonest complication following liposuction or even tummy tuck. Then you have seroma collection. As I explained earlier on, we work within the muscle, within the subcutaneous space, the space between the skin and the muscle. So if you have a lot of fat, you have a whole part of fat. This is the skin, this is the abdominal wall. After we take out the fat from the abdominal wall, that space is expected to collapse. That's why you use your garments, which is part of the cost also. You see, so many things are involved. So the skin is supposed to go and meet the abdominal wall and glue together. That doesn't happen overnight, it takes time. So sometimes there's a small gap and then the body produces fluid in between that space. That is what is called a seroma. and it's not much of a problem because it can be drained. And some seromas can actually linger for a very long time, but as long as it is identified, the seromas can be drained. Sometimes you may need repeated drainage. It's not a problem. Don't get worried. Seromas rarely get infected, but in some cases, if you don't drain them and it stays for a long time, seroma can actually get infected, or it can get solidified. It can give you lumpiness and all that. That is another complication that we commonly see following liposuction. Then some people actually have itching. Now itching results because the body is trying to heal, and it releases so many chemicals. Some of the chemicals, the histamines, the prostaglandins, some of them cause pain, others cause itching. Now, we need to give you drugs that will reduce the itching for those who have severe itching. Even on a normal day, if you have an injury on your hand, you discover that while it's healing, there's actually itches. So now when you have injury under your skin, the same process takes place. It's just that it's more generalized now, so it's like it feels worse. But there are also drugs that we give when people are having itching. Then hardness of the skin in the initial period. After liposuction, the body heals by forming some little blood clots. So those are the things that result into hardening of the skin, which happens in the first few weeks. For some people it could last longer, but then you expect those things to occur. When you have that, don't be afraid, it's normal. Then we've experienced that some people actually have fevers, maybe commonly in the second and third week after liposuction. It's not abnormal. Your body is trying to reset. Because just if you take out like 7 liters of fat from your body, 8 liters of fat from your body, you're a changed person. But the body has a register that it takes note of everything that you have in your body. So every cell is registered in the brain. So when those cells leave your body, the brain tries to reset and say, okay, let's calculate the number of cells that we have left. What do we need? It registers with the hunger center and all those things, the stomach. The whole body is trying to reset, and that can give rise to fever. So many times some people think it's because of malaria. Most times it's not for malaria. It's what is called metabolic response to trauma, and it's expected. If that happens, make sure you contact your doctor, and we usually will give you some medications for it. These are the few complications that we have. I'm sure some people have this thing. Loss of appetite. Loss of appetite, yes, very, very common. Dizziness, weakness, all those things follow this procedure. But we've never had a patient who has died. So this thing. Then maybe with that, I'll answer this question of anesthesia. Okay. That people commonly ask that, okay, what anesthesia are you going to use to do liposuction? Some people do local, and yes, I occasionally do local. But I've observed that it's very discomforting to do local anesthesia and do a very good work. Because just imagine I'm pokering you over and over. Even though you're not feeling the pain, but you feel my hand moving and you are conscious of what is going on, it can be very uncomfortable. So we prefer that you sleep. Because when you don't sleep, your muscles are very active and the risk of injury is actually higher when somebody is awake, because if you are moving, the cannula can create more moves. The control on the cannula is less. But when you are sleeping, usually your muscles are relaxed, and the control of the procedure is actually much better, and the outcome is better. I've had people who have said, "Look, Dr. Malu, I want to be awake. I don't want to sleep." I say, "Fine, I may not be the right doctor for you because I want to give you a good result, and I know very well that if you have to be awake, I may not be able to achieve what I want. I don't think I can be able to take out 5-6 liters of fat from your body if you are not sleeping. I can take out 1 liter, maybe if you just a little fat somewhere. Yes, we can try that. But then 5, 6, 7, 8 liters of fat is something that is very difficult to do while you are awake. So prefer that you sleep." Then people ask, how many hours am I going to sleep? Now, we don't give people an injection and ask them to sleep for 5 hours or 6 hours. No, that's not what happens. You are giving a gas that you inhale. As you are inhaling the gas, you are sleeping. Immediately we cut off the gas, you wake up. So it's not something that we will give you an injection and say, okay, this surgery will predict that this surgery is going to be 6 hours. So let's give an injection that lasts for 6 hours. Because some people's fears are that how about if you start the procedure and I wake up in the midst of the procedure? It's not like that. It doesn't happen that way. We give you a gas. There's somebody who is dedicated to anesthesia. There are 2 people in the theater. They don't do anything. Their work is just to make sure that you sleep. And while you are sleeping, all your vitals are being monitored. Your blood pressure is monitored. Your respiration is monitored. The carbon dioxide in your body is monitored. The oxygen in your body is monitored. Every important parameter, even your heart, the way it's working, is being monitored. So it's not something that you just pass on. You will die like that. No. Even when you are sleeping, nothing is monitored. When you are sleeping on a normal day in your room, you don't monitor those vitals. But then in the theater, we actually monitor those things. So it's actually safer than sleeping. In my opinion, I think if everything is done, and liposuction is very safe. Even tummy tuck is very safe because you are being monitored by the minute. And that's why when you hear that sound, ping ping, the sound that you hear in theater is actually from the anesthetic machine. It tells us if the sound changes, we know that there's a problem. And so you should not be worried about anesthesia. I understand some people may be scared. It's normal to be scared. It's just natural. If you are an ambitious person, you say, why am I going to do this? Do I really need it? How about if this happens? It's normal to have all these questions coming up.
Okay, another common question is concerning the reproductive capability of individual.
Yeah.
Okay, some people feel that if you have to have a liposuction, you should have completed your kids, you no longer going to have to be pregnant. Does it really affect having to give birth, or does it enhance it? What's the relationship between fertility and a liposuction or a tummy tuck?
Yeah, liposuction does not affect fertility, at least negatively. As I explained, we work within the subcutaneous space. We just work on fat. We don't touch your womb. We don't go near your womb at all. We just work on fat. And fat has a lot of things to do with hormonal levels. A lot of people that have abnormal hormonal levels in the body, it's related to obesity. So in actual sense, liposuction should help your fertility, because when the hormone level comes down, you can be sure that the outcome, the chances of getting pregnant will be better. So I've not seen any documentation, scientific documentation that liposuction will stop having future kids, and it's not on record. On the other hand, we know that there are potential benefits of liposuction after you take out fat from your body. We've seen people whose diabetes has been controlled after liposuction. There are medical benefits of liposuction, well documented. People who have diabetes, people who are hypertensive, people who have difficult hormonal issues related to obesity can be helped by liposuction.
Okay, another question here is about weight loss.
Yes.
Does liposuction prefer weight loss? Is that the aim of liposuction?
The aim of liposuction is a very common question, really. Many people say, oh, I'm tired of exercise, I want to do liposuction. No, you shouldn't do that. Liposuction is not a substitute to a healthy lifestyle. When we talk about healthy lifestyle, we're talking about exercise, we're talking about diet. It does not replace them. It's advised that you should have a healthy lifestyle before you do a liposuction. Yes, for some people, liposuction may boost their self-confidence, and so it helps them to be able to want to maintain it. If you look good, you want to maintain looking good. If you don't look good, you see no motivation. So liposuction could serve as a motivation to live a healthy lifestyle, but in itself, it's not meant for weight control. Again, we have seen that over 90% of our clients actually lose some weight after liposuction, but that's a side effect of liposuction, a beneficial side effect of liposuction, but it's not primarily for the purpose of weight loss.
Okay. So, can I get fat again after liposuction?
Yes, you can get fat after liposuction if you don't maintain a healthy lifestyle. However, we've noticed that from studies and experience, the fat will usually go to areas that you did not take out fat from. Because when the body heals after liposuction, it heals with fibrosis. It heals with a scar. So it's very difficult for the skin to open up for fat to accumulate again. So you notice that people who have had liposuction, their breasts get bigger if they are adding weight, because the fat will go to the breast, which is a good thing. then their butt also gets bigger. Even if they didn't have a fat transfer, if they are having any additional fat, the fat will be going to the butt. These are the common areas that the fat goes to. Generally, we advise you to maintain a healthy lifestyle so that whatever outcome you get from liposuction, you can actually be able to maintain it.
Okay. So another question here says, how long is the recovery period?
Very good. Recovery period is from 6 weeks to 6 months, because again it depends on how extensive your procedure was. Some people after 2-3 days can go home. Others may want to stay for 5-6 days or even 7 days after the procedure for close observation. But then healing is in phases. It's a gradual thing. The body does not heal overnight. I hear of people who want to come and do liposuction and then fly back to the UK tomorrow. It doesn't happen that way. If you do that, you're putting yourself at risk. That's why it's very good for you to do a procedure and hang around with your doctor. If you are coming from the US or the UK or from outside Nigeria to do your procedure, then we always advise you to plan to stay for at least 2 weeks in Nigeria. Very, very important. Or if you are coming from outside Abuja for your procedure, we advise that you plan to stay for at least 7 days. In Nigeria, it's easy because we have people that we work with in other parts of the state. So we can send you for follow-up with them, or they can check up on you if there are any issues. But after you finish your procedure, it's very, very important for you to be around your doctor for the first 7 to 10 days so that any issues can be sorted out within that period of time. The first 2 weeks are the most important weeks after any surgical procedure. So it's good you are around your doctor. Now, thereafter, healing continues because the body mobilizes to heal. And after the first phase, there's a second phase and a third phase. The first phase is the acute phase. The second phase, the subacute phase, where you have hardening and all the fevers we're talking about. Now, the final phase is slower, but it continues for up to 6 months or even more, where you have the softening. Those who have had fat transfer, it gets softer. Those who have had any body contouring, the hardness gets softer over this period of time. But most people do actually see the final outcome after 6 months.
Okay. So how soon can one resume exercises?
Again, it depends on the procedure you did. If you do a liposuction, you can resume exercises as early as 2 weeks. But you need to get our concept on the types of exercises that you can actually do. We encourage you to begin from light exercises to the heavier ones, not intensive exercise. And if you did a fat transfer, then please you need to wait for us to give you the go ahead before you do exercises. There are different kinds of exercise. Another question that people ask me privately: when can I resume sex? Okay. after liposuction? If you did a regular liposuction, then one can resume sex as early as you are comfortable. If you didn't do a fat transfer, but then if you did a fat transfer, I ask my clients not to resume sex for the first 4 to 6 weeks. Please, 4 to 6 weeks, because if you are lying on your body, it can deform it, and for the first 4 to 6 weeks, we don't want you to put pressure on your body. So better wait. After 6 weeks, you are free. We'll hand over your body back to you.
I think these are most of the questions we have here.
Yeah, I think with this, I hope you've attended to most of the questions, and we'll be back again next week for another session of question and answer. So if you have questions, please send them in. And those of you that keep sending private questions to me, please, I hope you listen to this session so that the questions will reduce. However, we are here to answer your questions. You can always call on our line if you have any questions. And if you are one of our clients, if you have any problems, please feel free to call me or to call the clinic or to check in so that you know what is happening to you. Thank you very much.
Thank you.
Really appreciate it. Bye. Bye-bye from me.
Bye.
No questions today.
No questions today. Okay.
Someone asked the question, or you felt you were not talking loud. I was not talking loud.